The facial nerve. Where does the facial nerve arise from? The facial nerve arises from the brain stem between pons and medulla at the CP angle. It has motor, sensory, parasympathetic, and taste divisions. Mediates facial movements, taste, salivation, lacrimation, and general sensation. Facial nerve is the nerve of the second pharyngeal arch, so supplies the muscle that develops from the second pharyngeal arch. So, what are those muscles? Muscles of facial expression, posterior belly of the digastric, stylohyoid, and stapedius muscle. These are the muscles they develop from the second pharyngeal arch. Where are the facial nerve nuclei located? The motor and the parasympathetic nucleus are located in the pons, whereas the sensory nucleus is located in the medulla. Around what structure the motor division of the facial nerve loops around? The motor division of the facial nerve loops around the nucleus of the sixth cranial nerve, the abducent nerve that supplies the lateral rectus muscle of the eye. What's nervous intermedius and where it arises from and what are its parts? The parasympathetic division starts from the superior salivatory nucleus, and the sensory division starts from the solitary nucleus in the medulla. So these two join to form the nervous intermediate, and this nervous intermediate enters with the motor part in the facial canal. These three nerves they pass through the geniculate ganglion. Which of them relays in the geniculate ganglion? Only the sensory fibers from the nucleus solitarius they relay in the geniculate ganglion. The parasympathetic and the motor part they don't relay in the geniculate ganglion. Sensory afferent of the facial nerve. The sensory afferent of the facial nerve are from the external ear, from the middle of the lateral and medial surface, soft palate, pharyngeal wall, and the taste fibers from the anterior two-thirds of the tongue by the chorda tympani. So what is the supranuclear course of the taste fiber? The taste fibers from the facial nerve which supplies the anterior two-thirds, the glossopharyngeal nerve which supply the posterior one-third, and the vagus nerve which supplies the taste buds in the epiglottis. They reach the nucleus rectus solitarius, and from the nucleus rectus solitarius the fibers project onto the ventral posteromedial nucleus of the thalamus, and from there they project onto the gustatory center in the parietal lobe. Where is facial canal? Facial canal is in between the internal auditory meatus and the stylomastoid foramen, and this facial canal has a tortuous course, so facial nerve has a tortuous course as well. So what are the nerves in the internal aquatic canal? The nerves in the internal aquatic canals are the facial nerve motor division, the aquatic nerve or the eighth cranial nerve, and the nervous intermedius. The nervous intermedius is between the facial nerve and the aquatic nerve. Which artery is in close proximity to the motor division of the facial nerve? It is AICA, anterior inferior cerebellar artery, is in close proximity to the facial nerve in the internal aquatic canal. The anterior inferior cerebellar artery is a branch of the basilar artery. It anastomosis with the posterior inferior cerebellar artery, which is a branch of the vertebral artery. The facial nerve may be involved in AICA syndrome, anterior inferior cerebellar artery syndrome. And what is that AICA syndrome? Sudden onset of vertigo, vomiting, nystagmus, dysarthria, imbalance, and facial paralysis due to facial involvement, and hearing loss due to the eighth cranial nerve involvement. What's geniculate ganglion? Geniculate ganglion is in the facial canal head, and it receives fibers from the motor, sensory, and parasympathetic divisions of the facial nerve. They pass through it, but only the afferent sensory fibers and the taste fibers from anterior two-thirds of the tongue they synapse in the geniculate ganglion. Which is the first branch to arise from the facial nerve? It is the greater petrosal nerve, which is a parasympathetic nerve and relays in the pterygopalatine ganglion and the postganglionic fibers supplied to the lacrimal gland. The greater petrosal nerve, so relaying in the pterygopalatine ganglion, and then it supplies the lacrimal gland. It also supplies the nasal glands and the palate, the glands in the palate. Pathway from superior salivatory nucleus to the greater petrosal nerve to the pterygopalatine ganglion and to the lacrimal gland and also to the nasal and the palatine glands. And what's nerve of the pterygoid canal? The nerve of the pterygoid canal is the greater petrosal nerve and the deep petrosal nerve. They unite to form the nerve of the pterygoid canal. So what's deep petrosal nerve? This is a postganglionic sympathetic fiber from superior cervical ganglion, whereas greater petrosal nerve is the preganglionic parasympathetic fibers to the lacrimal gland. Both of them unite to form the nerve of the pterygoid canal. The other parasympathetic nerve. The other parasympathetic nerve is the chorda tympani, which also carries the taste fibers from the tongue. The chorda tympani arises in the facial canal, relays in the submandibular ganglion, and then supplies the submandibular and the sublingual salivary gland. So what's the submandibular pathway? From superior salivatory nucleus, nervus intermedius, submandibular ganglion, submandibular and sublingual glands. With which nerve does the chorda tympani merges? It merges with the lingual nerve, which is a branch of the mandibular division of the trigeminal nerve, and this lingual nerve is sensory to the anterior two-thirds of the tongue. So the chorda tympani supplies the taste fibers to the anterior two-thirds of the tongue, and the lingual nerve sensory supplied to the anterior two-thirds of the tongue. What are the branches that arise in the middle ear from the facial nerve? These are greater petrosal nerve, the nerve to the stapedius, and the chorda tympani arise in the middle ear cavity. Which is the first motor branch that arises from the facial nerve? Is the nerve to the stapedius. What's the course of the facial nerve after it exits out of the stylomastoid foramen? Under the substance of the parotid gland, it divides into 5 branches: the zygomatic, temporal, buccal, mandibular, and the cervical, and supplies the frontalis muscle, which causes wrinkling, the orbicularis oculi, which closes the eye, the orbicularis oris, buccinator, and platysma. What are the motor branches of the facial nerve that arise between the styloid foramen and its division under the parotid gland? There are 3 nerves that arise in between from after the styloid foramen to its breakup. The first division is nerve to the posterior body of the digastric. The anterior body of the digastric is supplied by the mandibular division of the trigeminal nerve, the nerve of the first pharyngeal arch. The second branch is the nerve of the stylohyoid, and the third one is the posterior auricular branch. So these are the nerves that arise between the stylomastoid foramen and the break of the facial nerve under the parotid gland. The posterior belly of the digastric, the nerve to the stylohyoid, and the posterior auricular branch.